Recording has started.
Alexa, am I a go? Welcome, everyone, and thank you so much for being here. We're going to get started because we have a packed agenda today, but just a few quick housekeeping items before I introduce Ben Chandler. If you haven't already grabbed breakfast, it's on the counter outside this room. Bathrooms are right outside those doors as well. We will allow for questions after our keynote speaker and after each of our panels. Everyone, both those of you here in Louisville and those in our remote participation locations, can participate in the Q&A, and here's how we're going to do it. On your computer or smartphone, go to your internet browser and type in Slido. That's SLIDO.com. When the Slido screen pops up, you're going to enter in the event code Y753. That's Y753. The next screen has a box that pops up where you can type in your question. You can type in your question at any time during this conference while a speaker is speaking or during the Q&A. And then when it's time for Q&A, everyone's questions will start popping up on our computer screen here, and we'll answer as many of them as we can. You can also like the questions that others have asked, and questions with the most likes will appear at the top of the screen. Okay, if you need help with Slido, just flag me down, or Alexa's in the back of the room and can help you as well. Alexa, raise your hand. Okay, great. For those of you who need an official certificate for CEU credits, something more than the certificate of attendance that we'll be handing out at the end of the conference today, there is a sign-up sheet that will be there on the registration table where you picked up your name badge. We need to have you sign in because we have to turn that in by December 20th, and then you'll get your official certificate for CEUs. Finally, we do have one disclosure we need to make today. For the CEUs, Dr. Pat Purcell is a Pfizer adolescent advisor and a member of the Speakers Bureau for the Board on Immunization. And now I'd like to introduce former Congressman Ben Chandler, now President and CEO of the Foundation for a Healthy Kentucky and chair of the Coalition for a Smoke-Free Tomorrow. Ben?
Thank you, Bonnie. I appreciate all your hard work on this. And good morning to everybody here. Nice to see you all. Welcome to this conference put on by the Coalition for a Smoke-Free Tomorrow. The Coalition comprises some 175 organizations throughout Kentucky that are committed to improving our state's health by reducing tobacco use and exposure to secondhand tobacco emissions. We advocate for evidence-based policies at the state and local levels that are proven to achieve these goals. Foundation for a Healthy Kentucky is a founding partner of the Coalition, which launched in October of 2017. During the 2018 legislative session, we led the campaign for a $1 per pack increase in the state excise tax on cigarettes. This coming year, we will be focused on enacting a statewide tobacco-free schools bill. This bill will prevent many of Kentucky's youth from initiating tobacco use and ultimately becoming adult smokers. Given that most tobacco use starts before the age of 18, youth prevention can make a huge dent in Kentucky's tobacco use rates. We're always grateful for the financial support that we get for our efforts to improve health. Today, I'd like to thank pt.1 Health for helping make this conference free to all attendees. Tobacco use is an important health issue in Kentucky, and we're grateful for their support. So please show me or join me in giving a round of applause in gratitude to pt.1 Health. Attendees at today's event include, of course, everyone in this room, as well as participants in 5 additional Kentucky cities: Bowling Green, Florence, Hazard, Paducah, and Richmond. Special thanks to our partners in these communities for hosting remote viewing events. These partners include the health departments in Florence and Richmond, Baptist Health Paducah, the UK Center for Excellence in Rural Health in Hazard, and the Chamber of Commerce in Bowling Green. The coalition is hosting this conference because we're concerned that a new generation of Kentuckians may be growing addicted to the latest tobacco products. The use of e-cigarettes, also known as vapes and Juuls, surged 78% among high school students in just the last year, and 48% among middle school students. That's 1.5 million more kids nationwide starting the tobacco habit, most since the beginning of summer. But it's not just that more youth are using e-cigs, they're also using them more often. And it's often the flavors that are attracting them. Flavors like cotton candy and bubble gum. One of the main reasons the FDA banned flavored cigarettes in 2009 was because they appeal to kids. Although it is not called for an outright ban on flavors, the FDA did announce that it's planning some significant new restrictions on where they can be sold. We'll hear more about those today. As policymakers, health advocates, educators, healthcare providers, and payers, faith community leaders, and youth, we need to get ourselves up to speed on e-cigarettes and vapes. We need answers to questions such as, what's in them, and why do they even contain nicotine? What about the flavors? Are they harmful in and of themselves, or is the only concern that they attract kids? Are the pod e-cigs being modified to smoke marijuana and other illegal substances? Are e-cigs safer than regular cigarettes over the long term? Do e-cigs really help people quit smoking? So, let's get started learning the answers to these and other questions. And to introduce our first speaker, I'd like to welcome Sherry Craig. Sherry is Division Vice President of our sponsoring organization, pt.1 Health. Sherry has been with pt.1 Health and its predecessors since 2007, serving in various roles, including advocacy and development. She also chairs the Kentucky Chamber of Commerce Healthcare Policy Council. We're delighted to have her with us. Sherry.
Thank you, Ben, and good morning to everyone. pt.1 Health is really pleased to lend its support to the Coalition for a Smoke-Free Tomorrow and the Foundation for a Healthy Kentucky by sponsoring today's conference. It's really inspiring to be here among advocates here in Louisville and those of you that are joining us around the state. You all are all committed to protecting Kentuckians' health by reducing high rates of smoking. As partners on this journey to improve health outcomes, we all know the alarming statistics too well. Kentucky ranks last among all states in cancer deaths and near last in cardiovascular deaths, heart disease, smoking rates, etc. 10,000 Kentuckians die annually from smoking. E-cigarettes use among youth, as we'll learn more about today, is at an epidemic level, with evidence it is a gateway for smoking traditional cigarettes. There's no doubt that our challenges are vast. Yet I feel confident that each of us will leave here today better informed, highly motivated, and ready to act to ensure that our friends, our family members, our neighbors, and our patients at Kentucky One Health can enjoy the best of health and wellness. We are fortunate to open the conference today with one of our nation's top experts regarding comprehensive tobacco prevention and control, and it's my privilege to introduce him. Dr. Brian King is the Deputy Director for Research Translation in the Office on Smoking and Health within the National Center for Chronic Disease Prevention and Health Promotion at the Centers for Disease Control and Prevention. In this capacity, he is responsible for providing scientific leadership and technical expertise to this lead federal agency for comprehensive tobacco prevention and control. Dr. King joined the CDC in 2010 as an Epidemic Intelligence Service Officer, before which he worked as a research affiliate in the Division of Cancer Prevention and Population Sciences at Roswell Park Cancer Institute in Buffalo, New York. During his time at Roswell Park, his primary research focus related to tobacco prevention and control. Dr. King has worked for over a decade to provide sound scientific evidence to inform tobacco control policy and to effectively communicate this information to key stakeholders, including decision makers, the media, and the general public. He has authored or co-authored more than 100 peer-reviewed scientific articles pertaining to tobacco prevention and control. He was a contributing author to the 50th anniversary Surgeon General's report on smoking and health. He was a lead author of CDC's 2014 update to the evidence-based state guide entitled Best Practices for Comprehensive Tobacco Control Programs. And he was a senior associate editor of the 2016 Surgeon General's report, E-Cigarette Use Among Youth and Young Adults. Dr. King holds a PhD and MPH in epidemiology from the State University of New York at Buffalo. Please join me in welcoming Dr. King and giving him a warm Kentucky welcome. Dr. Brian King.
Wonderful. Thank you for that introduction. It's all true, folks, all of it. I'm going to apologize in advance because I'm in the latter stages of a cold. I was actually on the phone with my nephew over the weekend. He's 5 years old, and he was making sure I was getting him the correct Lego set for Christmas. And he had said, Uncle Brian, you sound like a chain smoker. And I said, Michael, I can assure you if there's anyone who is not a chain smoker, it is your Uncle Brian. But I think that it was actually kind of appropriate because it reminded me of what a wonderful job we've done in terms of denormalizing cigarette smoking in this country over the past several decades. But now we have this new issue with e-cigarettes, where it's a completely different beast, where we don't necessarily have that same knowledge, particularly among kids. And so what we don't want to be doing is playing what I call a game of public health whack-a-mole, that arcade game where you allow certain products to go down and then, you whack it and the other ones go up. And that's what we're seeing right now in e-cigarettes. So it's a reminder for my own home that we need to do a better job in terms of denormalizing all tobacco product use among kids. So without further ado, I'm going to get started, and I'm going to give you a nice leisurely overview of a variety of issues related to the topic of e-cigarettes. And I can tell you that this is probably one of the most divisive topics that I've ever experienced in my career in tobacco control. And not a day goes by that someone doesn't call me up asking for information, whether it be their child using e-cigarettes and they want to make sure that they get them off it, or someone calling me telling me the various orifices where I can shove CDC science. It comes from the full spectrum. But I think that in the end, everything I do and what I advise people is based on the available science. And that's what CDC does. We are an evidence-based institution, and that's why we have among the highest approval ratings of any federal entity. We are at 70%. I think U.S. Congress is about 10%. So we're doing pretty damn well. And that's because, again, we base everything on the science. And so today's talk I framed around the most common questions that I get from folks. And those are, what are these products? Why are they popular? Who's using them? Are they safe? And what can we do about it? And I think that the last one is particularly important because it's very easy to pontificate from a federal perch around what is a problem and, oh, it's terrible. But it's also key to say what we can do about it. And when it comes to tobacco control, we have the luxury of a half century of science showing us what works. And not all risk factors have that luxury. And so it's not necessarily a situation where we need to reinvent the wheel here with e-cigarettes. It's modernizing, putting a little grease on that squeaky wheel to ensure that we're addressing the diversity of tobacco products that are being used by our nation's youth. And that's where it really comes into the importance of making sure that we're not leaving anybody behind or any tobacco products when we're addressing this issue, which the FDA commissioner has recently called an epidemic, which is a pretty strong word for a specific product, particularly a tobacco product. So we'll start with what are they? I'll give a little bit of background. So the good news, folks, is that smoking rates are down. Cigarette smoking rates are the lowest that we've ever seen since we started assessing them. They've been coming down among adults since the mid-60s. Of course, the first Surgeon General was reported in 1964, was the impetus for that. And the most recent stats for 2017 were down to 14%. 14%, which is absolutely remarkable. The lowest we've ever recorded. The federal benchmark for 2020 was 12%. And I would have told you that it would have been a cold day in hell and Satan would have been giving sleigh rides if we were actually going to meet that about 5 years ago. But now we actually made it. And we're very close, within 2 percentage points of hitting that target, which is simply unprecedented. Among youth, same. We're still going down. We are now well below 10% among kids. Again, the lowest that we've ever seen. And that has been since the mid-90s. And so the reason we started seeing declines was in 1998, the Master Settlement Agreement between 46 states' attorney general and the tobacco industry, where they acknowledged the risks of tobacco use and have agreed to pay money in perpetuity to the states for the harms of tobacco use on society. And so we're going in the right direction for cigarettes. But the problem is that the tobacco product landscape is diversifying, and it's diversifying very heavily. And so I always like to remind people that we are in the business of tobacco control. We are not just in the business of cigarette control. And although we know that there's a continuum of risk when it comes to tobacco products, and combustible products are going to be more dangerous, and then you have smokeless products and then electronic products, there's a diversity of products being used, and none of them are safe. And that's particularly important when we acknowledge the risks among kids. And although there's some potential benefits of these products in certain circumstances with adult smokers, which we'll talk about later, when it comes to kids, the bottom line is no tobacco product use is safe, irrespective of whether it's combustible, non-combustible, or electronic. And so this is just a reminder of the diverse array of products that are on the landscape. And today I'm going to focus specifically on e-cigarettes and also give a little nod to heated tobacco products on the bottom, because I think that that's kind of the next frontier where the industry is headed. And it would be very prudent of us to make sure that we're getting out in front of this issue of heated tobacco products, because we didn't necessarily do that with e-cigarettes. And so this is our time to learn from past mistakes. And so e-cigarette landscape is rapidly diversifying. When we use this term e-cigarette or vape pen or e-hookah, primary gist is it's all one and the same. The anatomy is very comparable irrespective of the type of product. But this is a new schematic that CDC came out with our infographics. Since I came on board, I've been very keen on messaging content in a way that the American public can understand. And one of those is the use of these types of infographics. And so you'll see a lot more of this work coming out from CDC within the past couple of years. So in terms of the different types, we'll start from left to right. The e-pipe and e-cigar on the far left, these aren't particularly commonly used, but they do resemble the same size and shape as a regular e-pipe and e-cigar. Then on the far left, you have the larger tank systems. Sometimes those are called mods because you can modify them, and that's what you're going to find at a vape shop. And so those are very common among the more experienced users, and they give you full latitude to put the nicotine you want in them, the flavors that you want in them, and as well as other potential psychoactive substances as well. And then if you move over to the middle, these are the mid-size devices as well as the rechargeables. And so this is what Juul is. And so these are rechargeable, but then you replace the pod or the e-liquid into the device. And so you buy the individual pod and you can just replenish it as you deplete it. And so Juul is an example of that, which is circled that USB-shaped device. We'll talk a little bit more about that later. And then at the far right is disposable e-cigarette. And these are the same size and shape as a regular cigarette. And those, after you deplete the liquid, you throw it out in the garbage. And so convenience stores, gas stations, those are the types of places where you buy these products. And these are typically the starter product. People will purchase these and then transition into the larger devices. Now, one important thing to note also is the different players. Who's responsible for producing all? Big tobacco is primarily in the disposable e-cigarette game at present and encroaching into the rechargeable for certain devices. Juul is actually a San Francisco startup, so they are not currently affiliated with Big Tobacco, although Altria, the parent company of Philip Morris, has verbalized some interest. There's been some media in the past several weeks. And then the large tank styles are typically mom and pop shops. So if you got $10,000 in a dream, you can start up a vape shop. I was in Oklahoma recently, and they reminded me that they have more vape shops per capita than a Starbucks. So it's definitely a very rising place of potential revenue for a variety of municipalities, particularly in the Midwest. Oh, I'm not loud enough. I'm used to my New York foghorn. People are always telling me to tone it down. Okay, so the e-cigarette landscape is very volatile, okay? And so this was a study that we published in the Journal of the American Medical Association earlier this year with retail sales data. And this is very useful for us because typically we relies on these glacially slow population-based surveys. You know, these phone surveys that we do, which are wonderful for our gold standard tried and true estimates, but we only collect it once a year. So we lose a lot of that variability that occurs sub-annually. And so now we've been looking at retail sales data, which is basically the company Nielsen that records the number of people who watch certain shows. You know, if you're watching the Super Bowl and they're like X million people have watched, well, they also monitor sales. And so every time you go to the Target or the CVS and you scan a product, the UPC, it registers in a database and you can purchase that. And so we purchased that database for tobacco products, including e-cigarettes, and it gives us more real-time weekly data on what's happening in the landscape. So it's phenomenal to monitor trends over time in emerging products. So what you can see here, and this is not intended to be an eye exam for the folks in the cheap seats, I will walk you through this, rest assured, is the Juul is that dotted line that showed up in 2015. It entered the U.S. marketplace at that point by Pax Labs, was the parent company, now Juul Labs. And you can see that it gradually started increasing up through 2018. So by the end of December 2017, which was the end of this data collection, they had the majority of the market share, about 30%, surpassing all other companies. And presently, they now have 75% of the US e-cigarette market share. So it's doubled from what it was by the end of 2017. And so the take home here is that it's not the first time that a company has upticked in terms of use. So you can see back in 2014, British American Tobacco and Vuse skyrocketed up in use, but it shows the volatility of the landscape. And right now, Juul is where it's. And if imitation is the greatest form of flattery, they must be quite flattered because there's a lot of people now focusing on this USB-shaped device format, which has become an epidemic in our nation's schools and is particularly popular among youth. So what is Juul? It's a USB-shaped device. Normally I bring one and I forgot to bring it for show and tell today, but it's basically the same size and shape. You can put it actually is charged in a USB drive in a laptop. And so it's very difficult to even ascertain that it is in fact an e-cigarette. The product has gotten a lot of media attention. It's prominently being used in schools. I wrote a blog recently for big cities where basically kids are calling the bathrooms now the Juul room. And some schools have gone even far enough as to take the doors off of the bathroom stalls to combat the problem, which to me is a little counterintuitive to the primary intent. But it really gets at this issue that kids are doing everything they can to use the products. And it's not only in concealed areas. We do have reports nationally of kids putting them in their sleeves, and you can buy different kind of covers for the Juul device to match the color that you're wearing that day, and they'll exhale and inhale into their sleeve during a classroom session. And so kids are certainly getting creative, and they're also selling them to one another, similar to what we saw with Lucy cigarettes back in the 80s and 90s, where kids will sell a certain number of hits of Juul to their friends, say $1 for a hit, and so on. And so we're certainly seeing things that are very reminiscent of the past cigarette epidemic in this country. And it certainly points to the fact that we need to remediate immediately, particularly given the skyrocketing rates of use that have occurred in the United States. So another product, before I get into some of the broader epidemiology and health effects, is heated tobacco products, or heat not burn. You may be familiar with the term heat not burn, but I'm very leery about using that terminology because we're not quite convinced that burn does not occur, particularly for some of the studies that CDC has done. And so the World Health Organization and CDC call them heated products. And basically, these are different from e-cigarettes in that there's not a liquid. And so with e-cigarettes, you have a liquid reservoir, and then you heat it, and it creates an aerosol. And note that we say aerosol. It's not a vapor. That's a misnomer, which is some of the information that's coming out, from you all in terms of your materials today, reinforcing that the fact that's a misconception. And it is an aerosol that can contain harmful and potentially harmful ingredients. And so heated tobacco products also produce an aerosol, but they actually have tobacco in them. So there's a blade that pierces the tobacco in this mini cigarette, and it's the device that it's charged in looks similar to an iPhone. If you look at the packaging, it's actually remarkably close to an iPhone. Even when you open it and it says, hello, and then you keep going through the different layers, enthralled by all the technology that they've spent millions of dollars into promoting. And then once the blade heats the tobacco, it then proceeds to be inhaled by the user, similar to a conventional cigarette through this device. And so you actually have tobacco plant in the product, which is why the industry believes it's going to be far more appealing for users, because that's one of the reasons that regular e-cigarettes have not picked up as much among cigarette smokers in terms of being able to transition completely to the products, is because it's not as appealing to them. They don't get that same hit, that same throat hit as they do from cigarettes. And so the industry believes that heated tobacco products are potentially going to be the next coming in terms of the tobacco landscape. Philip Morris has perhaps the most popular at present, called IQOS, IQOS. And so that's currently under review by the FDA. There's 2 applications, and I have to be overly bureaucratic because I actually sit on the committee that reviews them. The Tobacco Product Scientific Advisory Committee with FDA convened earlier this year, and there's one application of whether the Philip Morris can sell the product in the U.S., and then there's another application for whether they can do a modified risk claim, basically saying that these products are safer than cigarettes. And that would go under the Surgeon General's warning on the pack of the product. And so right now the FDA is considering those 2 applications. The recommendations of the committee was that there's enough science to say that there's less harmful constituents in IQOS compared to regular cigarettes, but it's premature to make any health claims. Now, the FDA can do what they will with that information. They're not bound by the advisory committee, but this is a very new product, and it's important to note that the extent of the science available is from the industry. And so that's very complicated when the entity that wants to make money off the product is the only one with the science on the product. And so we'll see what's going to occur within the next year in terms of FDA's decision. But IQOS and other products are poised to enter the market. There have been heated products on the market before. So Eclipse is an example of that. They were around in the 90s, even back into the 80s. They failed abysmally. The public did not like them in the United States. But now this new technology, particularly on IQOS, and some people believe that the palate might have been primed with electronic products to potentially make these better received in this country compared to elsewhere. But presently, there's only one product available in the US, and it's Eclipse, and they got it through with what we call a substantial equivalence application. So basically, if your product has already been on the market and it's unchanged, you don't need to apply to FDA to have it re-enter the market. And so that's why Eclipse is currently in the market at present, and IQOS has that application to enter the market. So it's to be seen. Wells Fargo and other people who are making projections believe that these products could replace about 20 to 30% of the cigarette market share by 2030. We'll see if that will actually take place, but we do know that there's a lot of hubbub, and the industry is putting all forces behind this. So it's very convenient to them. They were recently court ordered to put corrective statements out around the harms of their products, and simultaneously they started ramping up their efforts around IQOS and other heated products, saying, yes, we now acknowledge the risks of cigarette smoking, but wait, there's more. We have this new product that we want people to transition to. So it was very convenient in terms of messaging. It does not surprise me that they opted to stop appealing the corrective statement litigation, because now they had a messaging point that could segue nicely into a new market. Okay, so next. Why are they popular? So This is an analogy, and I was on the Today Show about a month or so ago, and I used this quote, so I have to stop using it because I've literally like beaten the horse. But this is what it is. So it's the advertising will lead a horse to water, the flavors will get him to drink, and the nicotine keeps him coming back for more. And so this is this cyclical function of the different factors that are leading kids to use e-cigarettes. And there is no doubt in my mind that the advertising and the flavoring are driving the primary rates of use, particularly around Juul within the past year. And so when you look at these different factors, advertising is key. And so we do know from CDC data that 80% of kids nationwide are exposed to advertising to e-cigarettes, and that has increased within the past year. And the primary areas are retail sectors. 70% of kids are exposed. And this has increased in recent years, and it's because of primarily the master settlement agreement. So remember back in 98, I told you about that attorneys general agreement with the industry. And so once that prohibited the industry from doing things like advertising on billboards and other places, they've now segued back into areas that weren't covered by that, and it's primarily the retail sector. So you really saw the industry shift in the late 90s, early 2000s to retail, and that's where it's still at. And so it's no surprise to me that we're seeing a lot of e-cigarette advertising there as well. It's the point of sale, point of purchase. You're going to get a lot of kids as well. They're being exposed in those environments, but it's really been the trend for the past 2 decades by the industry. Television is a kind of a new realm, 40% of kids. Remember that cigarette advertising has been banned on television since the 70s and smokeless since the 80s. So this is a glaring loophole for e-cigarettes, where there are no prohibitions around the advertising of e-cigarettes on television. And you see various individuals who are promoting them as celebrity endorsees, including Jenny McCarthy, who I would not consider to be a pillar of public health advocacy on multiple fronts. And then you also have the internet as well, and YouTube, where you're getting a lot of indirect paid advertisements for these products. And so it's not necessarily that the industry is paying for it, but you have children and other front groups and individuals that are doing it for them. And so that's definitely a rising issue, particularly for Juul and other products. And then you also have newspapers and magazines. Important on the Juul front. So they recently made a voluntary announcement that they are no longer going to advertise via social media, particularly Facebook, among others. They selectively did not include Twitter in that prohibition. But it's important to note that it's very convenient for someone to say that they're no longer going to advertise the product when you already have 75% of the market share, and kids are basically advertising the product for you. So, don't necessarily you got to get through the smoke and mirrors on some of the recent announcements. But right now we have an epidemic where an industry has the 75% of the market share. You don't need to advertise the product anymore. Kids are doing it quite handedly for you in the schools. And then the flavors are also a big deal. But before that, I'm just going to talk about the evolution of e-cigarette messaging. And I include this because I love when the industry and other people do media interviews, because it's, especially with the internet age, because everything just stays forever. And so this is an example of the evolution of how the industry has messaged on these products, and particularly Juul. So back in 2015 in The Verge, there was an R&D engineer along with other very senior leadership at Juul, that was quoted as, "We don't think a lot about addiction here because we're not trying to design a cessation product at all. Anything about health is not on our mind." Okay, so that makes sense. I would guess that's probably the case back in 2015. Then fast forward to now 4 years later, when they are basically, pariahs in the public health community and elsewhere, now that all these kids are using their products, and primarily kids are using these products, now they're putting a full-page ad out in the Washington Post saying, "Juul Labs is on a mission to improve the lives of the world's 1 billion adult smokers by eliminating cigarettes." So complete 180 now that you have a public relations nightmare and your dollars are now at stake. And so this is very similar to traditional tobacco industry tactics. So don't be fooled, folks. The 2016 Surgeon General's report concluded that e-cigarettes are advertising using the same themes and tactics as the conventional industry. So although some of these companies may not be directly linked to big tobacco, it's the same themes and tactics. And why is that? Because they work. Okay, you don't need to fix something that's not broken. And so these same factors that led to youth initiation of conventional products, including cigarettes, are the same when we look at these emerging products, including Juul. Okay, so now on to flavorings. Flavorings are a big influencer for kids, and we've known that for decades with conventional products. That's why the FDA initially banned cigarette flavorings, characterizing flavors, and that's why we're looking at a similar proposal from the FDA now for menthol and other flavorings. 85% of youth who use e-cigarettes report using flavor varieties. and a study by FDA published in JAMA using the PATH data, the Population Assessment of Tobacco and Health, which this was actually the first study that they published using PATH data, which is a very big deal, was on flavors. And what they found was that flavors are the primary reason that kids report using e-cigarettes, and that it's also the primary product that kids start with in terms of e-cigarettes for the first product that they use as a flavored product. And then, of course, we know that the vast majority continue to use them. And so there's a variety of new flavors coming out in different varieties, including with Juul. This is slightly outdated. They did change creme brulee to just creme, and then they removed the accent, because kids will no longer use that because of that. Okay, so who's using them? So now let's go into the epidemiology. So again, sorry for folks in the cheap seats. I'll walk you through this. This is adult data. So let's focus on adults first, and then we'll transition into the kid issue. These are from Styles, which is an internet survey that CDC does every summer. And so this is a complement to our tried and true gold standard surveys, because we found that these glacially slow phone-based surveys were not doing it for us when we needed rapid response data. So we started doing internet panel surveys where we fielded it in June and July and got the data by August, which is phenomenal when you think of government ability to collect data in a timely manner. And so we've been doing this since 2009. We were ahead of the curve, despite several people criticizing us for not being. We were actually among the first entities to collect data on e-cigarettes. It was so low back in 2009 that we couldn't get reliable estimates. But we started in 2010, and this is ever use of e-cigarettes among adults. And it's separated out by current, former, and never regular cigarette smokers, okay? So regular conventional cigarette smokers. So the top line is cigarette smokers. The middle is going to be your former smokers. And then the bottom is your never smokers. And you can see that we skyrocketed up to about 2015 among adults, and then it's plateaued, even declined a bit in recent years. Among never smokers, it's kind of continued to gradually increase and has plateaued. And don't discount that never smoker line, because 6% of never smoking adults is still millions of people. So you've got a lot of people that are using a product that otherwise haven't been exposed to nicotine, which is problematic. But this current and former smokers is about what we'd expect, given that many people are trying to use these products to help them quit. And so with that, those are the current trends. I can tell you that going into 2018, it's looking like we're actually seeing a decline in e-cigarette use among adults. Right now, overall, among all adults, we're looking at about 2.8% is the most recent data. This is slightly outdated from 2016, or is around 3%, but it's coming down, which is the complete opposite trend from kids. So kids were skyrocketing up and adults were actually declining in use each year. And so this is important to remember when you're considering the balance of the net public health benefits or risks of the products. And one issue that's very important is this whole dual use phenomenon. And it's particularly important when we look at different age strata. I shouldn't use the word strata, that's a very scientifically stuffy term. Age groups. And so if you look here at this different figure here, you can see that it's the people who have used e-cigarettes by conventional cigarette smoking. And so what we see here is the main line, the white line on each one, is the number of e-cigarette users who are also smoking cigarettes. And so that's 60% for everyone overall. So that shows that most people who are using e-cigarettes continue to smoke cigarettes. And so this dual use issue is a concern, because if you're going to have a benefit for an adult smoker, you got to quit completely. And that's not necessarily what's happening. Now, it could be a means to an end. So it's possible that these people are using them ultimately for eventual cessation. But right now, we know a lot of people are using both. And that's public health concern, because we know that smoking even a few cigarettes per day is dangerous for your health. So 1 to 2 cigarettes per day is going to double your risk of dying from coronary heart disease. So that's problematic. You got to quit completely if you're going to reap that full benefit. But what's really critical for this, and I like this figure because CDC released it through something called a quick stat. And this is a phenomenal method that I adore since I came to the Fed, because the more you write, the more you have to defend, and the harder it is to clear when it comes to the government. And so quick stats is just a figure. There's no text. You just put the figure out and you let the public decide how they want to interpret it. So we forced out this figure, and it has very useful tidbits. Not only is it the dual use issue of the 60%, but look at the dark blue line. This is the proportion of people who have never smoked cigarettes, the proportion of e-cigarette users who have never smoked cigarettes. And so if you look at overall, it's about 10%. And so these people who have never touched a regular cigarette but are using e-cigarettes, but look at the young adult line, 18 to 24, it's 40%. So 40% of the young adults, 18 to 24, who are using e-cigarettes have never smoked a regular cigarette. And so this is a population of people who are now being exposed to nicotine and the inherent public health concerns around that, potentially priming them for addiction and the use of other tobacco products. So don't be masked by just that overall estimate. And that's why CDC and others message heavily on youth and young adults, because that young adult demographic is particularly important when we're talking about nicotine, the threats of addiction, but also harm on the developing adolescent brain. And don't forget that the brain continues to develop until age 8, about 25, okay? 25, 26. And so this whole concern over nicotine and priming is not just the youth issue. And also, as we heard earlier, that 9 out of 10 adult smokers begin before the age of 18. And we also know that like 99% are before young adulthood. So if we can prevent people from starting before age 25, you've got a generation of tobacco-free adults, which is the key end game. So here's some state-specific estimates, and I always I love to come up and speak in Kentucky and elsewhere, but you all have among the highest smoking rates of anywhere in the country. You've been duking it out with West Virginia for years, and unfortunately the same is similar for e-cigarettes, and you've made some commendable progress within the past few years, but still among the highest. In the e-cigarette issue, it's still comparably high, or at about 6% according to the most recent BRFSS data. But there's a lot of other people in the same company. So you don't necessarily see the same trends as with conventional cigarettes. But remember that the slide I showed earlier, that most e-cigarette users are current and former smokers. So you'd assume that the trends would be similar, but e-cigarettes are a bit more ubiquitous in the American public. And that's because there's a lot of different price points, and they've been advertised in a way that don't necessarily have those same disparities that we see for conventional cigarette smoking. So higher rates of use, but traditionally lower in some areas with the more progressive tobacco and long-standing tobacco control programs going back to the 90s, such as California and New York. Okay, so here's the youth data. So this came out from CDC. This was in the notes from the field, an MMWR mechanism around the 2018 data. They were actually leaked beforehand. It was not me, for the record, who leaked the numbers. It was not CDC either, but they showed a 78% increase in the use of e-cigarettes among youth within the past year. No doubt in my mind that's because of Juul. And so we knew this was coming. And the reason we knew this was coming was because of the sales data. Remember that I spoke about earlier with Nielsen? And so basically looking at the sales data, we saw a marked uptick in the summer of 2017. And we do this survey of kids in schools in the spring semester. So the kids took the survey in 2017 and we saw a slight uptick, but it wasn't significant. We thought, there's something here. And we'll see next year what's going to happen. But it was kind of the canary in the coal mine, the calm before the storm. Because then the kids went home over the summer and they learned about Juul, and they went on YouTube and they found out, at camp about it from their friends. And then they brought it back to school in that fall. And that's where we saw the skyrocketing increase in the amounts of media stories. And then in 2018 in the spring is when we saw the 78% increase among kids. So we knew it was coming. We didn't expect it to be this pronounced. But now we have what the FDA commissioner has called epidemic proportions of use among our nation's kids. And we note that we did see a decline in 2016. So we were making progress. And that was around the time the Surgeon General's report was released, and states and locals and the Fed were doing a lot of messaging around risks of e-cigarettes. And so we've completely reversed that progress that we've made. That's important to note, that we were headed in the right direction, and now it's a complete reversal, and it's primarily because of Juul and these other USB-shaped products. So data specifically on Juul initiative that has focused on these products, and we're seeing about 6% of current use, 8% among young adults. And so a decent proportion. We expect that will probably increase as our methods continue to get more precise around collecting these data. But some interesting tidbits from that data as well. 1 in 5 students have seen Juul used at school, so about 20%, and that's only the ones that have seen it. I think this mic is and so 3/4. So what does that speak to? We may have enforcement issues in the retail sector where kids can walk in and just buy these products. It's not necessarily just in the internet or for family and friends. We have 3/4 who cannot, who are getting these products directly from brick and mortar. And then of particular note for the public health community, 2/3 do not know nicotine is always in the device. And I can unequivocally tell you that every Juul device has nicotine. They have announced a lower grade nicotine, about 3% concentration, but every Juul device has nicotine, and anyone who tells you otherwise is severely misguided. I'm sure they're very nice people, admirable intent. They're just severely misguided. Okay, so are they safe? Biggest question that we get on these products. So it comes down to the net public health benefit. And so there's a lot of discussion within the past few years around, harm reduction and the potential benefits, risk of these products. And I'm going to fully acknowledge the science here. So there's a risk continuum when it comes to tobacco products. Some things are safer than others, okay? And so at the far end of the spectrum, you've got e-cigarettes, and then you have smokeless products, and then you have combustible products such as cigarettes and cigars. Cigarettes are by far the most deadliest. The Surgeon General has said responsible for the overwhelming burden of death and disease from tobacco. And it's an inherently defective product. So that's what I like to call them, because if you think about it, if used as directed, cigarettes kill half their users. Okay, that's not a really good track record. If that was a bottle of shampoo, we would have pitchforks and torches outside of FDA getting them to remove these products up. But you have a product that's killing half its users if used as directed. So e-cigarettes are nowhere near that. Okay, there's still some discussion around what the exact percentage safe they are. Some people say 95%. I wouldn't go that far because there's so much variability in the products. But we know that e-cigarettes don't have near the 7,000 chemicals and 70 carcinogens that conventional cigarette smokers, but that doesn't mean that they're safe, okay? So safer is not the same as safe, and that's an important distinction, particularly when we're talking about kids. And so when we're talking about kids, it's like, well, you're basically asking, do you want to jump for a 13-story building or a 6-story building? It's like, well, why don't we just take the elevator down and walk out with everybody? We don't need to settle when it comes for kids and discussing this harm continuum debate. That's an adult discussion, and especially in order for that to occur, you have to show that the products are effective for cessation, which we'll talk about later. But in the end, if you're going to have a benefit from e-cigarettes, the adult cessation has to outweigh the youth initiation, and that is simply not what we're seeing right now, particularly as we're seeing skyrocketing rates of use among youth. Remember, you got 2.8% of adults using the product and 21% of high school students. So 7 to 8-fold higher rates of use among kids compared to adults. And that's why the public health community is so justifiably outraged over what we're seeing. And we cannot leave kids behind in this discussion of harm and risk reduction among adults when we don't even have a product that's been effectively proven to help adult smokers quit. The cessation issue is a necessary prerequisite for harm reduction. You don't have harm reduction if the people aren't quitting. So, is there a potential benefit for e-cigarettes? Yes, the CDC is on the record. People have skewered me on this, and they focus on just what, they cherry pick what's said and what is not. But I acknowledge there could be a benefit for these products, but that's theoretical, okay? It's not necessarily the reality of the situation. So if an adult smoker were to transition completely from cigarettes to e-cigarette, there would be a benefit. Yes, absolutely, if you transition completely. Does e-cigarettes have nearly the same 7,000 chemicals, 70 carcinogens? No. But on balance, most things are safer than that. That's a pretty horrifying public health standard. 7,000 chemicals and 70 carcinogens is pretty tough to compete with. Now, that being said, you can't just cut back, because smoking even a few cigarettes per day is going to be harmful for your health, particularly coronary heart disease risk factors, as well as respiratory disease. And so it's no surprise to me that the emerging science on health risks around e-cigarettes are those more acute effects, particularly respiratory and cardiovascular. And that's a very important focus, not only for youth and young adults, but also for those never smoking adults who are using these products as well. You're introducing a threat to the lungs. And people frequently ask me, they'll say, oh, well, what's the risk of, inhaling this thing into your lungs? And I said, well, generally, anytime you inhale something into your lungs, it's going to be potentially problematic, particularly if you're lighting it on fire. With the case of cigarettes, or in the case of e-cigarettes, it's an aerosol with potentially harmful ingredients. And so it should be no surprise to us that the emerging science is showing inherent health risks in terms of respiratory and cardiovascular outcomes. So where are we on the cessation issue? So Cochrane reviews have come out, 2 different reviews, which are kind of the standard body in terms of acknowledging the state of the science on this issue. And the gold standard for these studies are what we call randomized trials, as well as cohort studies, which follow the same people over time. And those are critical because you can see what came first, the chicken or the egg. Did people effectively quit? And so right now we have a few dozen of those studies, but in terms of randomized trials, there's less than you can count on one hand. Those are the more robust one, where you can control for all the different factors, and you can say almost definitively that they, e-cigarettes are responsible for X, Y, Z. That being said, the current reviews are pretty consistent in their messaging that the science is inconclusive on the efficacy of e-cigarettes for the purposes of cessation. And that was reinforced in the National Academy's report that was commissioned by FDA earlier this year, which said overall there is limited evidence that e-cigarettes may be effective aids to promote cessation. So that's where we're at in terms of the current science. There's some science showing people are more likely to quit. And there's an emerging body of studies that shows that the product can vary in terms of cessation efficacy. So people who use those larger tank style systems may be more likely to quit. And that's about what we'd expect because they have more nicotine. So if you can get the person more nicotine, the likelihood that they can effectively wean completely off of regular cigarettes is going to be higher. So we'd expect that. If you can get an efficient delivery system of nicotine, you're going to get people to wean off. Which is also why it's very interesting to me that big tobacco is not in the game of the tank style devices. They're very much in the game of the disposable, smaller nicotine varieties. So that would ensure that you continue to use both because there's not enough nicotine to get you off of conventional cigarettes. That being said, in terms of other studies, there's some studies showing that people who use these cigarettes are less likely to quit as well. And so this could be a situation where you continue to use more nicotine and you're just getting more dependent and you're using devices that aren't going to replace that yield. And so bottom line here is the science is not conclusive yet on the efficacy of e-cigarettes. And I fully acknowledge that people are quitting using e-cigarettes. Frequently, I travel all over the country, all over the world, and say, my Aunt Sally quit using an e-cigarette. And I say, that is marvelous. We want people to quit. And I commend Aunt Sally for quitting. But that, my friends, is an anecdote. And the plural of anecdote is not data. And when you look at data, right now, we are not seeing a population-based impact of these products in terms of efficacy for cessation. And so we may get there. We may get a regulated device by FDA that is shown to help people quit, but right now we're not there. And we need to be very cautious about dropping these products from the helicopters to the masses, particularly as we see skyrocketing rates of use among youth. And so we need a well-regulated environment where we're prohibiting the use of these products and working to reduce them among youth while keeping an open mind about what could happen in the future for adults in terms of cessation and continue that science. But we very much need a precautionary principle approach when it comes to public health to protect our. Okay. So here's the potential health risks. So I talked about the potential benefits. Here's the potential risks, of which there are many. I'm going to go from left to right and not spend much nuance on these. Bottom line, the first one is the gateway issue. Do e-cigarettes lead kids to smoke cigarettes? Jury's still out on this. The National Academy's report I mentioned earlier out of FDA had a moderate conclusion on this, so not sufficient evidence. But we've got about 24 studies from multiple countries, including the US, Canada, and the United Kingdom, all of which have shown kids who use e-cigarettes are more likely to smoke in the future. Now, there's different magnitudes of that, from like 2 to 8-fold higher, depending on the study and the general average across. So does that mean that every kid who uses an e-cigarette is going to go on to smoke cigarettes? Absolutely not. But this is one added egg in the basket of concern in terms of why kids should not be using products. We are seeing some transition, and this isn't also not surprising. We messaged on this for many years. Tom Frieden, my former boss at CDC, got blasted when he came out, 5 years ago on this, but he ultimately was right on it. And that was because nicotine primes the brain for addiction. And so if you're using a product with very high levels of nicotine, it's no wonder that you would transition to a higher risk product. We've seen that for decades with conventional cigarettes going on to harder drugs. And so it wouldn't be surprising that that would also be occurring for e-cigarettes as well. But of note, not every kid who uses an e-cigarette is going to transition on. But the currently available science suggests that that is the case, although we do need more science on that issue to adjust out for some of the limitations of those studies. There's also concerns over relapse among former smokers. We know that former smokers have about a 1.5 increased risk of relapsing back among those who use e-cigarettes. And so that is a real concern that we continue to monitor and get more data out. But of most notable concern is this concern over diminishing smokers from using proven quit methods and diminishing the chances that a smoker will quit. So if you look at some of the rates, CDC released a study on what methods people use to quit, and e-cigarettes are far and away the most common. And then if you look at the 7 FDA-approved meds, they're far further down on the list. So the people aren't using the things that are scientifically proven. They're using the bright, shiny object in a hopes of breaking this addiction, which we know cigarette smoking is highly addictive. And so it's very important for us to consider these factors, and that we're not potentially shifting the population away from the things we know work for these bright, shiny objects. There's also concerns over secondhand aerosol. We do know that it is in fact an aerosol, and so it has potentially harmful ingredients, including volatile organic compounds, ultrafine particles, heavy metals, and potential cancer-causing agents, as well as some of the flavorings that are included as well, which is why we now have 10 states as well as several hundred communities across the country who have included e-cigarettes in their smoke-free laws, which makes sense. That's the official position of the CDC, as well as the World Health Organization and the U.S. Surgeon General, that e-cigarettes should be included in smoke-free policies, because the standard here should be clean air, okay? Any tobacco product emissions should not be allowed in indoor environments. And then there's also concerns over glamorization, renormalization in the media of these, advertising. And I feel very strongly about this. And frequently the First Amendment comes up. And, my response to that is there's a very easy way to responsibly advertise your product. And that has absolutely nothing to do with the First Amendment. And so if you look at the way that a nicotine patch is advertised, it's very tactful. It's very empowering. It's very independent. You have a person with a patch on their arm saying, I want to live to walk my daughter down the aisle. I want to see my grandchildren grow up. That's not what you're seeing for e-cigarette advertising. So if people were so intent on using these products for effective cessation delivery, which if they advertise it like that, it would be a violation of FDA regs, they wouldn't be doing so, with scantily clad women on Sports Illustrated issues and men in hot pants parading down the street. This is not the type of advertising that's going to empower people for cessation. It's focused towards youth and young adults. And we've seen that across the spectrum, and particularly on the internet and elsewhere. And so just consider that. And so, I have a very little patience for the First Amendment, argument on this, because yes, you can say what you want, but if you are really intent on focusing on a cessation paradigm, you could do so in a very mindful and respectful way, which is what we see with things like nicotine replacement therapy. And then also poisonings is a very real concern. CDC began monitoring this back in 2010. Back at that time, we were getting about 1 call a month to poison control centers nationally for e-cigarettes. That increased to about 400 a month in 2014 and has remained around there since that time. But here's the kicker. Of those approximately 4,000 that we see across the entire year, half of those are for kids less than 5 years of age. And so you have very real concerns over the ingestion of the liquid among kids, as well as dermal exposure. There was an incident in North Dakota recently where a school administrator had confiscated a Juul device and an e-liquid, and the residue from the liquid had absorbed into his hands dermally, and he started manifesting signs and symptoms of nicotine toxicity. And, they called up CDC, and they're like, well, how could this be the case? We had to bring him to the emergency room after he was exposed to the liquid. I said, well, was he nicotine naive? Had he ever been exposed? And they said, no. I said, well, I believe it then. Depending on the concentration, we have to get tox results. But, nicotine is highly potent, and some of these e-cigarette concentrations are very high levels, where someone who's never been exposed, if you touch it dermally and it's absorbed, you can start seeing an effect. It's not necessarily you're going to drop dead, but you're going to experience, signs and symptoms of nicotine exposure. And so something important to remember, there's a lot of routes that you can be exposed to nicotine, and dermal is one of those that can be particularly effective. We saw that with snus, that smokeless product, for many years, where athletes would put it between their toes. And so you weren't smoking it, so you didn't see it, but you were getting a heavy nicotine hit in a very concealed environment. And so we're seeing the same, with this issue of e-cigarettes, where you can get very high levels of nicotine over very short periods. And so the poisonings is a very real concern. We did have 1 death in upstate New York of an infant, and then we did have a suicide as well of an adult who injected the liquid intravenously and ultimately died from nicotine toxicity. Just remember, nicotine is not a completely benign substance and can be very toxic at high enough levels. And we do use it in NRT, nicotine replacement therapy, but it's regimented. You go from 21 milligrams down to 14 milligrams down to 7. And the intent is to wean over time. And so it's very effective in a regulated dose where there's an ultimate goal of going down to 0. But that's not necessarily seen with e-cigarettes. Okay. So another issue here is this issue of nicotine. And so I've been harping on this to anyone with a pulse for many years. And so, the haters come out. Haters are going to hate. And they basically use the federal data against us, which everyone loves federal drama. The Monitoring the Future study came out saying they asked kids if they use nicotine in e-cigarettes. And so Tom Frieden and myself have been harping for many years about the concerns over nicotine, and they're in these products, and it's a no-brainer, right? The product is designed to deliver nicotine. So it shouldn't be problematic to say most of the products contain nicotine. And so basically the Monitoring the Future data came out where they asked kids if there was nicotine in the device, and like 25% of the kids said yes. So immediately all the haters came out and said, well, most kids aren't using nicotine varieties, so you're completely wrong and your public health messaging is completely untrue. So this is my response to that. And at the time, I kind of knew what was up. I mean, I wasn't born yesterday, maybe like the day before, but not yesterday. And so I knew exactly what was up. And my response was, I question whether kids know what nicotine is, let alone whether it's products that they're using. It's like asking a kid if there's taurine in a Red Bull. They don't have the foggiest idea. So then I went home on the elliptical that night, which is my typical like hypothesis building exercise after a long day. I go on the elliptical and I think through, how the hell are we going to deal with this? And so then it came to me, and it was the Nielsen data was the answer to the question. And I said, we've got to get the Nielsen data. We'll monitor the UPC around the nicotine content and see what the number is. And so we did that. And this is what we found. And it was published in the American Journal of Public Health. We found that 99% of the e-cigarettes on the US market contain nicotine. So this notion that 75 to 80% of the kids are somehow finding 1% of the market share is absolutely delusional. It does not make sense. And that's because the product is designed to deliver nicotine. And yes, there are some 0% varieties, but it's primarily in the vape shops in these areas where the kids aren't necessarily accessing. And so you're going to have slight overestimation because you're not getting internet sales and some of the vape shop sales in these numbers, but still it's far and away higher than that 25% number of kids. And so we've really got a two-pronged issue here where we got, high levels of nicotine in these products, but you've also got a lack of knowledge, particularly among kids, around what's in these products. And when it comes to Juul, those other data from Truth showing that 2/3 don't even know nicotine is always in the product, it just is really a kick in the pants for us as a public health community to help quell those misperceptions and lack of knowledge, not only among kids, but youth influencers as well, such as educators, parents. So another issue, if you're not horrified enough among the kid issue, with Juul, we've got this issue of nicotine salts, which is kind of a double-edged sword. And so basically, we'll go back to our high school chemistry class. Let's think back. Oh, it might be horrifying to you. I think they still teach chemistry in high school. I don't know. I spoke to a high school group recently, and some of the questions kind of struck me, as odd. And I was thinking, you could disable an entire generation if we just started writing in cursive and driving stick shifts. The kids would not be able to function at all. And so with, this issue around, anyway, we'll go. So chemistry class. And remember you had the acids in base. And so if something is very acidic, it's red, it's very low. And if it's more alkaline or basic, it's going to be blue. You put the litmus test. So most tobacco, when you extract it from the plant, it's going to be done so with ammonia. And what that does is it makes it very alkaline or basic. So it makes it very blue. So the nicotine that we typically get for tobacco products and e-cigarettes is very blue. But that also means that it's very volatile. So it's wild and crazy. It's going to be very harsh to you when you use it because of that. So what did Juul do with their patent? They basically reduced the pH of the product. And so they brought it down using benzoic acid. And what does that do? Well, when you lower the acid, make it more acidic, you're going to make it less harsh. And it also creates what we call a nicotine salt. And so in making it a nicotine salt, it's going to be a lot less crazy, which means it's going to go down a lot easier. So who is that a concern for? Kids and young adults who have never been exposed to nicotine, where they now have a very high yield nicotine product that's going to go down a lot easier. And so this issue of nicotine salts is a very real concern to us as a public health community, because it's not only high rates of nicotine, but it's a new type of formulation of nicotine, which is this proprietary patent out of Juul that is doing very well in terms of administrating nicotine, which is why it could be a particularly useful cessation tool for adults, because if it can efficiently deliver nicotine at very high rates in a far easier format, it could help adults. But it's also very problematic for kids, which is the primary concern that we're seeing right now in terms of these products. And the company itself has acknowledged that a pack of cigarettes is equivalent to one pod of Juul. And I think that that's actually on the low end. I think that it's at least one pack equivalent. And so there's a lot of nicotine in these products being delivered at very high levels in a lot easier format. Okay, another issue is generally recognized as safe for the flavoring. So the FDA has standards for generally recognized as safe, or GRAS. And a lot of the flavorings that are used in e-cigarettes fall under those standards. But the problem is that these standards are for ingestion, they're not for inhalation. So the gut can handle a lot more than the lungs. And the gut also has an exit strategy, right? We don't have that with lungs. And so you need to remember that these things are being very inhaled deep into the lungs, particularly ultrafine particulate, and they're staying there. And so a lot of these flavorings, we don't know the long-term risks of inhaling over a very prolonged period of time, even though they may be safe to ingest. And so that's something important to remember. Don't get too caught up on, well, the FDA has said this is safe to eat. That's not the same as to inhale into your lungs on a prolonged daily basis. And so some of the flavorings, particularly diacetyl, are of noteworthy concern. Diacetyl has previously been linked to a severe respiratory illness, bronchiolitis obliterans, which is we found it in popcorn workers many years ago, which is why it's called popcorn lung, and they traced it back to the buttery flavor, diacetyl, which was used after the workers were exposed over prolonged periods. And so we see very high levels of diacetyl in e-cigarettes, about 75%. Some of the lab studies have shown of e-cigarettes contain diacetyl. Does that mean that people are getting bronchiolitis from using obliterans using e-cigarettes? No, but it speaks to this issue that very high levels of exposure to some of these contaminants, particularly at occupational levels, could potentially result in severe respiratory illness and disease. So the flavors are another factor that we don't want to forget here in terms of health. And then finally, other psychoactive substances. Marijuana is by far the most common. I've heard different statements from across the country in terms of crack, cocaine, heroin, alcohol, caffeine, you name it. We have probably heard someone trying to use it in an e-cigarette. Whether that gets yield to the user is another story. But we do know that these products are commonly used with other psychoactives. Marijuana is the most common. 1/3 of youth e-cigarette users report using marijuana in the product. And there was data out of Yale and Connecticut youth that it was 20% of middle school students that use e-cigarettes. So that's like 12, 13 years old. So prominent use of other psychoactives. Okay, so I'm going to wrap it up and then we'll close this out. Tobacco control vaccine. This is something else I've been harping on for years to anyone with a pulse and an inclination. And it really reinforces this population-based approach. So remember that prevention is key, folks. Prevention is a hell of a lot cheaper than cleaning things up on the back end. And I think it was what Benjamin Franklin, an ounce of prevention is worth a pound of cure. So he figured it out like hundreds of years ago. So we can get it right now. And when it comes to tobacco control, prevention is key. We got to stop those 9 in 10 adults who began as youth from starting altogether. And so we have this proven paradigm. And this was recently published in the journal Tobacco Control, which is a fancy journal that I'm sure none of you have ever heard about. And it actually got the cover. They put it on here. So if you want a signed autographed copy after, I'm more than happy to do so. And so it focuses on smoke-free policies, price increases, cessation access, hard-hitting mass media campaigns. This is our paradigm of population-based prevention. And when you implement these in the context of regulation, effective regulation, you're going to get that effective prevention measures and that impact at the population level. So the same goes for e-cigarettes, which is why in the Surgeon General's report in 2016, as we focused on that same paradigm of those proven interventions. Remember, greasing the wheel, not reinventing the wheel. And that's what it comes to when we talk about e-cigarettes. And we've got a lot of different, ways to do that. It's not just put on the Fed. A lot of things have been done by FDA within the past couple months. Federal regulation is critical. And it's a very key lever that the U.S. Congress gave to FDA. But on balance, of keynote, it did not preempt states and locals from acting. And that's a very important lever, that you are not preempted, because we know that preemption cuts states and locals at the knees in terms of effectively implementing policies and percolating them up to the state and national level, which has been the bread and butter of tobacco control for decades. And so you can see there's a lot of things that states and locals can do, including those smoke-free policies, increasing the age of sale to 21, licensing retailers, setting price policies. There's a lot that can happen at the state level, which is very key to complement what's happening at the Fed. And remember that everything that FDA has done has been met with litigation and lawsuits. It took us 10 years to get the corrective statements out. So just remember that there's a lot of things that continue to move forward at the state and local level in coordination with those FDA national regs. And so here's just a few of the recent, and these are new in quotes, efforts by FDA. They've announced other things related to flavor prohibition sales, but they implemented an 18 age of sale standard and also have some other things coming out in terms of e-cigarettes shortly. Basically, flavored varieties will only be allowed to be sold in certain venues with age of sale restrictions. And they're also proposing a potential menthol ban on cigarettes, although menthol e-cigarettes would also be available for sale as well. So we've got some new things coming out, primarily as a result of these skyrocketing rates of use among kids. But again, we don't want to underestimate the importance of state and local action as well. As I noted before, a lot of states have included e-cigarettes in their smoke-free policies. We've seen great progress. Several hundred communities have done that. That's now the norm in terms of implementing smoke-free policies, including the diversity of products, and also Tobacco 21. which the FDA cannot do this. They're prohibited from going over 18. So this is strictly a state and local action. And we now have 6 states as well as over 340 cities and communities that have done this, including e-cigarettes as well. So I'll close it up. Of course, I think it's very easy to pontificate from a federal perch about, what an issue is and what we should do about it. And I fully understand that there's a lot of parameters that are hindering our ability to accomplish this, including diversification of the landscape. Disparities persist in use. Of course, dollars. The cash is in the kitty, but we're not necessarily spending it on tobacco control in most counties and states across the country, including, the master settlement dollars. And there's also disruptive players. And so just remember the industry is heavily involved in this, as they have been in conventional cigarettes for many years. And I ultimately, get a lot of questions on, whether we should partner with the industry. And my response to that has always been that, lest we forget that these are adjudicated racketeers that have been convicted in federal court of deliberately misleading the public on the risk of their products. So you have to be very mindful. It's like accepting an invitation for a winter barbecue from the Donner Party. No thank you, folks. So just be very mindful as this landscape evolves, and, Juul is now being looked at as a prospect by Philip Morris and Altria. And I know that there's a lot of, background, particularly with, big tobacco and tobacco growing states, including Kentucky. But, these calls to partner with industry is something that's a very real concern from a public health community, particularly as Juul Labs attempted to infiltrate curriculum into schools across the country, which we know from several decades only serves to actually increase use among youth and further, be problematic in terms of the epidemic facing our country. So with that, here are the answers to all of the questions. We talked about e-cigarettes. We know they emit an aerosol that the user inhales. Why are they popular? Remember the advertising and the flavors. The advertising brings the horse to water. The flavors get them to drink. The nicotine keeps them coming back for more. Who's using them? We know it's markedly higher among kids. Most commonly used product among kids since 2014. 3% of use among adults, 21% among kids. So this is very much a youth problem, an epidemic at present. Are they safe? Safer than cigarettes, but not safe. And when it comes to kids, they shouldn't be using any tobacco product. So precautionary principle applies when we're talking about kids. Although, we do acknowledge that if an adult smoker were to use them completely to quit smoking, there'd be a benefit. But science on the efficacy of cessation is still mixed. And then finally, what can we do? Modernize our interventions. Okay, remember, grease the wheel, don't reinvent it. We know what works. We've got 50 years of science showing us what works. We just need to include the diversity of tobacco products in our efforts so that we're not playing that game of public health whack-a-mole, allowing certain products to go up while others go down. We are in the business of tobacco control, folks, not cigarette. And with that, I will close my mouthpiece and give you my contact information. My email is very easy to remember, baking@cdc.gov. due to my wonderful middle initials, so you can send me your favorite recipe or any other questions. I do actually answer my email. And I am on all social media. CDC's Office on Smoking Health, we've been very keen on that in the past couple years. cdc.gov/tobacco, a lot of infographics, parent provider cards for messaging to youth. We work very closely with the Office of the Surgeon General and have a few other things up our sleeve within the coming months that we look forward to releasing to the public to help you all at the state and local level. So with that, thank you very much. I appreciate the time today. Are we out of time for Q&A, or do we have? Oh, marvelous. I love Q&A.
We do have time for Q&A, so we're going to pull up the Slido screen in just a minute here. If we do have media questions, you should feel free to ask them if you don't have Slido, or if you don't use Slido, feel free to ask them, and we'll just repeat or Brian will just repeat your question.
Yep, will do.
Into the mic. I did have a question. Right now, we only have adult e-cig data. We don't have youth e-cig data for Kentucky. My first question is, when will that data be available? And my second is, does the current survey tool capture that? Because do kids know, for example, that e-cigs means Juuls?
Yeah. So we definitely know that there's going to be some underestimation. So we're working at least at the national level to include Juul in our survey questions. But the fact that we're still seeing skyrocketing rates of use without including the Juul terminology suggests that we're still capturing a decent proportion of it. But we're definitely working to improve our questions to make sure that we're addressing the diversity of products. The data out of Truths do show that about a third of kids who are using Juul specifically use that terminology. And so they may not be captured in the standard surveillance of e-cigarette use. In terms of the standard output of data, is Kentucky, do they do BRFSS or YRBS? They do? Okay, so that's every 2 years. And so you should have 2017 data, and then the 19 data will be coming out next year. And we have worked very closely with the YRBS folks to make sure there is dual terminology on that question. So beginning with 2020, you'll have that data to move forward. But in the meantime, the 2017 data should be available. If not 15, marvelous, good. And so that would be a past 30-day measure. Again, it's not going to capture dual, but I think it would behoove you to really capitalize on, the recent skyrocketing rates of use among youth nationally from NYTS and elsewhere to reinforce that you could see increasing rates in 2019 with the next data. So I think it's ultimately a variety of different, data sets to help reinforce the issue. But most states have seen an increase going in to 2018 that are collecting data annually in addition to their YRBS. So I would suspect that would also be the case with Kentucky as well. But nomenclature matters, not only for policy, but also for surveillance. And if you don't use the right terminology, you're not only going to get underestimation, in your surveys, but you're also leaving loopholes for your policies. Yep, gentleman in the middle.
In addition, YRBS.
Oh, excellent.
Probably about 3/4 of the. And as of 2014, we've had e-cigarettes.
Great.
That survey and what we found from 2014, 2016.
We're going to ask the gentleman to come up. I cede the floor to you, sir. For the folks on the web, a gentleman in the audience is now going to tell us about the e-cigarette surveillance.
No, the point I was trying to make is that in 2014, we included e-cigarettes in our school survey. And when we looked at that same number in 2016, the 30-day consumption rate went down. However, we did not ask in that menu of questions, we didn't have the dual question. So as in our next include that, and we anticipate the number going up for the same reasons that you mentioned about nomenclature. That's all. That's the point I wanted to make.
Yeah, absolutely. And I think that sometimes this biennial data collection masks what's happening on the off year. And so a lot of these folks that did the 14-16 survey saw that decline. But if you look at the annual data, we went up in 15, then we went down in 16, and we kind of inched up in 17. And so it's just that volatility of the market and the importance of getting those data on as a recurrent basis as we can to really inform policy and practice. It's a volatile market. Okay. The first question, well, this is very easy. To what extent does CDC coordinate with FDA? Every single day, folks. We are very well coordinated. Not a day goes by that I am not talking to someone FDA, including Mitch Zeller, the top of the Center for Tobacco Products, as well as others. We, of course, have fielded the National Youth Tobacco Survey since 2011 with the FDA. And we coordinate very closely with them on the release of data, including that 78% increase that was reported in the media. So rest assured, there's the trifecta, I call it, of federal agencies. It's FDA, CDC, and the National Cancer Institute. And so FDA does regs, National Cancer Institute does science and funding, and then CDC does science and public messaging and work with states. And so we're very well coordinated, and we have very good working relationship across the board in terms of the leadership across the agency to really hit all these major buckets to address particularly this growing epidemic youth. Next question. I have heard that the Juul is equivalent to an entire pack of cigarettes. Is there any truth to this? So I briefly mentioned this in my talking points. And so this comes from Juul itself. It's on their website. So it's something that they publicly acknowledge. And that's in terms of the actual nicotine content of the device. And so they have said publicly that they believe that the nicotine in one Juul pod is equivalent to at least a pack of cigarettes, or they say a pack of cigarettes. I would argue that it's actually more. My guesstimate is about 1.5 to 2 packs based on the science that we've done at CDC. And so, that's definitely the low standard. In terms of how many hits you can get from a pod, it's going to be anywhere from like 50 to maybe 150 hits from the device from a single pod, depending on how hard you inhale and how frequently. But you're definitely going to get a large body of nicotine from these products. It's among the highest nicotine concentration of any e-cigarette on the U.S. market, to the point that it's illegal to sell in many countries, which is why Juul came to a lower percentage nicotine. It's currently 5% in the U.S. market product, which I think there's a lot of misperceptions among the public, because you see 5% and you think that, oh, well, that's very low. but it's actually quite a lot. It's about 60 milligrams per milliliter, very high concentration. Okay. As all of us sit here drinking our drug, caffeine. Oh, ouch! This one is starting off. Well, oh, with a smiley face though. Thank you, questioner. That really alleviated my heart palpitation. Well, you differentiate the effects and or dangers of nicotine versus caffeine on the brain body. So I think that this is, a frequent thing that comes up, in terms of addictive nature and, caffeine and nicotine. A lot of the mechanisms are quite similar, but you also have, the added benefit or the added problem with nicotine is that it's highly addictive. And when you look at some of the rat models back in, the 80s and 90s, the rats would go for the nicotine before heroin and cocaine. So, very highly levels of addiction. And so a lot of times people like to compare them both as, kind of being on par, but that's simply not the case when you look at the etiology and mechanism of addiction. Nicotine is highly addictive, and there's also the concerns that it primes the brain for harder things. And we've seen that for many years in terms of, cigarette smoking leading to harder drugs, particularly among youth as well as among adults. And that's kind of what we're seeing now as well with e-cigarettes, where you have a product that contains nicotine that, is potentially priming the brain for, addiction to harder substances. We also know that nicotine harms the developing adolescent brain, particularly the prefrontal cortex. This is the area of the brain responsible for learning, memory, cognition. And so it's particularly problematic for kids when they're exposed to nicotine that could have long-lasting effects and also, again, prime the brain for addiction. So, frequently we like to, make these, apples to oranges comparisons around things, but we do know from the available science that nicotine is very highly addictive. And it's, of course, the primary ingredient included in tobacco products and e-cigarettes. So it's not an apples to apples when it comes to these, and we just have to remember the specific impact of nicotine and its role in priming the brain for addiction. Let's see. Comment on UNC study on e-cig effect on immune genes. So typically CDC has a policy of not commenting on specific studies done by other people. So I'm not going to go into the nuances, critiques of individual studies. But I think, again, this, as I noted before, one more egg in the basket of concern around e-cigarettes, and that it's a very new product. It's been around for 10 years, but we haven't seen the uptick until around like 2011, 2012. And so unfortunately, it's hard to get research dollars for something until it's a problem. And so this is something that, the researchers in the room actively lament, that it's very hard to get research dollars for things that aren't already a problem. And so when it comes to e-cigarettes, within the past year or two, we finally started to see, evidence grow on the specific adverse health effects, whether that be on immune system or, various genetic factors, as well as respiratory disease, cardiovascular disease, and others. And so the science is growing, and it really points to this issue that these products are not harmless. There's relatively broad consensus in the public health community and research products that it's not, harmless. But there are implications around, the potential effects of these products, both behaviorally, genetically, and also in terms of, addiction and other factors. And so, bottom line is science continues to grow. Broad consensus that products are safer than conventional cigarettes, but that doesn't mean they're safe. And as the science continues to grow, more dollars will undoubtedly see, more information on the potential health effects, both in terms of adults, but well as youth.
Great.
Okay, thank you much.
Any questions that we were not able to answer, we will try and get those answers out on our website. We will make Brian's presentation available on the website. We are going to take a 6-minute break, okay, for restrooms, and right outside this door, there's also some breakfast out there, and then we'll bring back our expert panel. So starting right at 10 o'clock, we will begin again. Thank you.
Thank you. Oh, yeah. I know. I haven't been heavily involved. I was very
But yeah, I saw the document. I'll just let you guys talk. I know you're here, and I just want to. Should I find you have Oh, thank you. Glad to hear that. So we don't want to. No, I think it's a very real concern. It's a very Yes, yeah. I don't go because they're a little aggressive. So I did ship my bag. Oh yeah. Oh, that's where it was. Hey, how are you? So you got my slides? I do. I will one warning in this teaching. Because we're going through the mini conferences, I in a second for it to pop up on this. So just give it a moment before you start advancing a lot. Okay. It'll take a second to catch up. We can go ahead and have our panelists up to the speakers table, please.
Hi, nice to meet you as well. I think we changed the order. I think I'm going to follow you.
Okay.
On you. So Scott will.
Okay.
Me, he's got kind of a bridge between adult youth and then the other person.
Right. So
specifically on you. Yeah.
So we decided that we're going to do 5 minutes of presentation or something for each person, then have a discussion.
Thought it was
7.
7 to 10. I thought,
7 to 10.
yeah,
Okay.
yeah.
7 to 10. Okay.
I think so. Well,
Okay.
was it? I don't know. You better ask Bonnie. 6 slides. I don't know.
6 slides. Okay, no,
yeah.
I have like 12, but I can go through them in like 2 minutes.
Yeah. Yeah.
So,
okay. Good.
my picture there was like,
Hi, I'm Melissa Quaddy. I'm one of the speakers.
Oh, hi,
Melissa.
How do you
Yeah. Nice to meet you.
You are at the end, right? Yep. Yeah, so we'll have Audrey go at number 2 and then Scott then Pat, and then
If I could have Dr. Purcell and Dr. Weaver to the front, please. Dr. Purcell and Dr. Weaver.
I think fun is so then the rest of it focuses on you. I think so. We thought it made more sense to do that first and then keep the focus on you. Yeah. Okay.
there is a extra chair.
Oh, are we okay on the end there? So we'll.
All right, ladies and gentlemen, welcome back. We're going to get started again.
I guess the first is.
If you'll all take your seats. And I'm just looking for Dr. Purcell for our expert table. Welcome back, everyone. Our expert panel will be moderated by Dr. Aruni Bhatnagar. He's a professor at the University of Louisville School of Medicine and leader of the Envirome Institute. And under that, the American Heart Association Tobacco Research and Addiction Center. Dr. Bhatnagar's research has led to the creation of the new field of environmental cardiology. His work is supported by multiple National Institutes of Health grants. Please welcome Dr. Aruni Bhatnagar.
Good morning. We're going to continue with a panel discussion. It's very hard to follow the elegant presentation by Dr. King, but we try. So what we're going to do is to have a short presentation from each of the panelists, and then we'll have some time for question and answers. So I would start with sort of giving us just an overview of the general state of the understanding of e-cigarettes and and their cardiovascular effects. So you just heard from Brian about how there are different variety of e-cigarettes, and each one has their own characteristic of different types of toxicity, different types of chemicals that are produced. They contain a variety of different chemicals, including nicotine, propylene glycol, glycerol, and when the e-cigarette aerosols are heated, they generate chemicals that are known as aldehydes. E-cigarettes also contain fine particles and flavors. Each of these different components of e-cigarettes have a sort of a specific or somewhat unique toxicity profile. You heard a lot about nicotine and how it is a strong vasoactive drug and it has a variety of different effects. Similarly, propylene glycol and glycerol have their own biological effects, particularly when they're heated, and they lead to the generation of these aldehydes. And I'll talk about that a little bit more. With the particles, also there is a lot of evidence suggesting that exposure to particles, fine and ultrafine particles, particularly in the ambient air, can have adverse health effects. That's the adverse health effects associated with exposure to air pollution. And then flavors. So we know that e-cigarettes do not contain the large number of different chemicals that are present in tobacco smoke, but of course they do contain sort of the nicotine and other constituents we listed. So there is concern that maybe there are less effects, but there are at least some effects. And as Brian pointed out, that most of these effects are likely to be either respiratory or cardiovascular. So what do we know about what these effects may be? There have been a variety of different studies. And of course, if you're looking at cardiovascular function, a best way to understand that is to look at blood pressure. And we know that in young, healthy non-smokers, inhalation of e-cigarettes can lead to an increase in both systolic and diastolic blood pressure. And people who are habitual smokers, there is increased arterial blood pressure after e-cigarette use. And even though these effects are much smaller than those seen with the conventional or what we now call combustible cigarettes. But in the long term, in long-term studies, there have been no sort of definitive evidence of whether there is a change in blood pressure. There are some reports that there may be no change, but this is a very sort of short duration of study, and even with tobacco smoke, it takes years of smoking to see any changes in blood pressure. Then you can see something in a couple of years. And indeed, in smokers, the blood pressure early on is generally lower than people who are not smoking because cigarettes contain carbon monoxide, and that decreases blood pressure. So this is a very deceptive sort of an outcome, and so it's not sure what the effects of e-cigarettes long-term are on blood pressure. But these products also do have what we call sympathetomimetic effects, and what that means is that if you are inhaling nicotine, it has the same effect as, say, an increase in adrenaline. So it activates the sympathetic nervous system, and a good indication of that is an increase in heart rate. And as you can see, that if you smoke an e-cigarette with nicotine, you get an increase in heart rate. Without nicotine, it's much less. So it would mean that most of the effects or the stimulatory effects of e-cigarettes, particularly the increase in heart rate, may be associated with the nicotine present in e-cigarettes. So again, sort of stressing the point that Brian was making, that nicotine is not an innocuous drug, and it's a very strong, potent drug indeed. So there is emerging data also showing that long-term e-cigarette use might be associated with very significant adverse outcomes. And this is data from Stan Glantz lab showing that people who are smoking e-cigarettes have sort of a elevated risk of having a myocardial infarction. And this is data from the PATH study, from the National Health Survey, sorry. And so it would mean that maybe there is some evidence, and this is because of survey, and so we cannot say this is sort of definite evidence, but at least preliminary evidence that smoking e-cigarette by itself could increase the risk of having a heart attack. And we think that that might relate not to the variety of different toxins that are present in cigarettes, because most of them are missing in the e-cigarettes, but to the presence of nicotine in e-cigarettes. So certainly there are both sort of data from acute exposures as well as from sort of long-term exposures that e-cigarettes may be not good for your heart. But are they really reduced harm products? And this is a debate that goes on for has been going on for a long time, because certainly CDC has contributed a lot of that too, and the FDA. And generally people think that because e-cigarettes contain much less amounts of toxicants than normal cigarettes, that they would be certainly be less toxic. So this is the general conception that if you remove 90% of the toxins out of cigarettes, then you make an e-cigarette, then the e-cigarette obviously logically should be 90% safer. And that's the reason that a lot of public health activists, particularly in the UK, have declared that e-cigarettes are 95% safer than normal cigarettes. The sort of fallacy in that logic is that it assumes that there is a linear dose-response relationship. So as you decrease the toxins, you get a proportional decrease in toxicity, which may not be the case. And we know from studies on cigarettes and tobacco smoke that the dose-response curve is highly nonlinear. So what this means is that the risk of smoking 2 packs a day, about 80% of the risk will be transmitted by only smoking 3 cigarettes a day, right? So the 3 cigarettes a day impart as much a risk as smoking 2 packs a day, because the dose response actually flattens. And this is for heart disease. For cancer, the risk is linear. So the more you smoke, the more risk of cancer there is. So what this, it's a bit of a complicated idea, but what this sort of conveys is that if you had a product that would have 50% of the risk of cigarettes, tobacco cigarettes, you would not see a very significant decrease in the health outcome. And that if you have sort of even 80% reduction in the risk, you would still have more than 50-60% risk, because the dose response curve is nonlinear. So this means that the overall toxicity of e-cigarettes, in our view, is uncertain, and that risk is determined by this sort of a nonlinear relationship, but also by use. So if e-cigarettes are 50% safer, say, than normal cigarettes, and you smoke as many as twice as many e-cigarettes as normal cigarettes, with all the nicotine that you want to get, then you are essentially at the same place. So there isn't a sort of a validated independent criteria to attribute risk or extent of risk to e-cigarettes. It depends upon the use pattern, and so varies from individual to individual. So in any case, what we need to understand is where these things are being sold and used. And this is analysis from a recent analysis from the BRFSS data, and it shows that there are specific areas where there is a much higher prevalence of e-cigarette use than others. And therefore, we should be sort of open to the idea to understand what are these regional differences and how these regional differences affect the use of e-cigarettes, and what particular policies should be installed or should be enforced to be able to sort of at least partially overcome this disparity. But most of the people who are using e-cigarettes are youth, and that's no surprise. But there is much in the young category as well as in the young adult category. And I think what we need to be cognizant of is that if there is this fear of actually starting addiction to e-cigarettes, then we might be in a sort of in the fear of addicting a whole new generation to nicotine and tobacco, and that all the gains that we have made against tobacco would be readily eroded by this social normalization of e-cigarette use. So that's one of the concerns, that suddenly we have made smoking, and or now we call it vaping, cool and acceptable, or even now sort of readily available to kids. And so there is a great danger that if we don't act now in the appropriate way, and we do some things that are uncertain in our approach to this epidemic, then we might be in a greater problem than we've had before. So at the American Heart Association, we've been trying to develop coherent ideas about how we could have a policy about e-cigarettes, and whether or not that these are reduced products. Our beliefs are that we do not have enough data to advocate that they are relatively safe, that whether they could be used as cessation devices, and whether that we could recommend their usage to people who do not use nicotine, or people who are trying to quit. So I will end here, and then we'll invite other members of the panel to present their talks. Our first talk is by Dr. Audrey Darville, and she's Associate Professor and Certified Tobacco Treatment Specialist from the University of Kentucky. So, Audrey.
Thank you. There we go. It's a pleasure to be here. Thank you. I enjoyed Dr. King's ad about Juul, but I'm sort of a history buff as well. And so I looked back at some early advertising for Blue, and I think it's really interesting. At that time, there were sort of these side-by-side comparisons. And I think when we talk about what I'm going to talk about, e-cigarettes for adult cessation, because we really don't know probably anything about if youth are using them to quit. But it's important to see the messaging that came out with electronic cigarettes initially. And that was really centered around taking back your freedom in rebellion, against smoke-free policy. Some of the issues, you probably can't read it here, but it says smoke virtually anywhere, no tobacco smoke, only vapor, promoting that idea that these products were so much safer, just water vapor, and that the flavors were made in the USA. Interesting. So my colleague, Dr. Weaver, is going to talk more about flavors, but I just sort of wanted to start with a little step back looking at nicotine. We've talked a lot about nicotine priming the brain for smoking, use of other drugs. But I think there's one additional point that is important to remember with sustained or persistent tobacco use. And that is that adult tobacco users, and probably is going to be the case for kids as well, that they don't smoke necessarily, they smoke for the hit. They like the hit. But over time with the addiction, what happens, same thing with opioids, another sort of hot topic here in Kentucky, right, is that the smoking becomes what they need to do to maintain feeling normal and to avoid withdrawal. And so I think that if we don't have that perception that, people are smoking not necessarily by choice, which is what the tobacco industry wants us to believe, but because they have to feel normal, we get a good sense of why quitting is so challenging. Oh, went too fast there. So this is, again, I'm a history buff. So back to 1972, a physician working for Philip Morris at that time, oft quoted, this came from the tobacco industry documents, talks about why cigarettes are such a great delivery system for nicotine. I suspect in Juul Labs, you may find similar documents. They're looking to perfect the delivery of nicotine because nicotine is the hook. Nicotine is the thing that keeps people using tobacco. And so, this the advertising I think is key, but I think we have a tendency to underestimate the power of nicotine. So why are adults vaping? Well, as was noted, the vast majority of them are doing it to try to quit. Is it working? Probably not very well, right? As we see by some of the information that was presented earlier. And I'll talk a little bit about that. They're also vaping to avoid smoke-free restrictions, and I think this ad kind of highlights and illustrates that point, what the industry had focused on in terms of, this sort of, up yours for smoke-free policy, the rebelliousness of using these products. We know the flavors are very appealing, but for nicotine, one of the issues is that the delivery of nicotine has been highly variable, and I think that's a key point when we talk about using these products for cessation. There's been no attempt, prior to Juul, to sort of standardize or normalize the nicotine concentrations like we have with nicotine replacement products. And so with variable nicotine levels, we see varying success. In fact, the studies that have shown the best outcomes with cessation for adults are with the big mod tank devices where people can get higher doses of nicotine. Now, we don't know the impact of Juul, and as Dr. King mentioned, maybe they will present some new opportunities in terms of delivering nicotine in a more standardized and more efficient way. That question is not answered and is not anywhere near ready to be answered yet at this point. But the variable concentrations of nicotine is a big hindrance to using these products for cessation. People want that steady state, as I had in that first slide, because they don't want to feel bad when they're not using tobacco. They don't want to feel withdrawal. And so they will self-regulate. Numerous studies have shown that people self-medicate and use devices to maintain a certain level of nicotine. Marketing, like has been talked about, is very pervasive and effective, and this data out of Kentucky shows that we not only smoke more, but we vape more here. So this whole idea of harm, less harm, harmless, I think is key, a key element to the discussion of cessation in adults and how we balance that. I liked your balance scale there that you had, Dr. King, because that's really what I see as the crux of the issue coming from an adult treatment perspective and youth prevention perspective. We know nothing kills like tobacco, right? I mean, that's just a given. So the way that I usually illustrate that is, we've got the most harmful thing, tobacco, and so we're trying to make something less harmful. That's not a very high bar to have to go over, is it? And so, using these products for cessation, it needs to be balanced against the benefits of the risks of youth use. And so I'm going to talk about that just a little bit. So this is the hypothesis that I've come to with vaping, that if vaping is determined to be less harmful, and we just heard about how much less harmful is really relative depending on what we're talking about, cancer, heart disease. But if we assume that that means less exposure to toxins and people switch completely, which we've heard is really not happening, then we could see these declines, okay? But we're not seeing it yet, and I think that's the key. Another issue that's come into play is a recent study that I believe, Dr. Weaver, you participated in, and it showed that the adults that are using e-cigs are using them, are trying them, but also there's a growing perception that e-cigarettes are more harmful necessarily than smoking, which is not the perception that we want to maintain. So the evidence for quitting comes out of, you saw this, the NASEM report released in January of 2018. And we heard from the previous presentation that the evidence is limited that e-cigarettes may help people quit combustibles, but there's also no evidence that dual use has any health benefit, and we've certainly talked about that. And then this survey, this from the National Health Service in Great Britain, is really based on expert opinion and not necessarily the solid science that we're looking for here. So if we look at vaping for cessation, what are the concerns? Well, certainly the benefit we talked about, but some of the costs. costs are dual, multiple product use, which we know is really common. Delayed quitting, using safer, more effective treatments. We have great progress. Hats off to the legislation here in Kentucky, who, we have great benefits for tobacco cessation and tobacco cessation products. They're not being used to the full extent, but there's some concern that when people are using e-cigarettes without help, they're not taking advantage of these methods. Youth initiation, which we've talked about. Also, there's a whole separate impact on vulnerable presentations, which time just does not allow us to get into. But I think it's important for us to make that distinction that it doesn't affect everyone equally, and that people who are vulnerable to tobacco are also vulnerable to getting access to products that are not going to help them quit, but potentially thinking that they are. And then certainly the whole effect on secondhand smoke exposure and the renormalizing of tobacco use. So I would pose these questions here just for us to ponder and think about when we think about using e-cigarettes or electronic devices for quitting for adults. We want to know, will people quit, switch, or vape and smoke? And I think the evidence probably points more closely to the latter, but again, we don't have enough data. Can the 400 plus devices, which are the fewer chemicals, come from 7,000 potential chemicals? How can we kind of, you talked about dropping these things from a helicopter, how are we going to regulate that, realistically in this environment, in the environment that we're using now? And then what impact will renormalization? Thank you.
So our next speaker is Dr. Scott Weaver, is Research Assistant Professor at Georgia State University.
Morning, everyone. I'm delighted to be here. Please pardon my voice. Like Dr. King, I'm also getting over a cold. I think it's something going around in the Atlanta area. You might want to stay away. Okay, there we go. So I'm delighted to be here to be speaking to you about the e-cigarette flavors and providing a brief overview of the evidence of their impact on use and health. So first, most e-cigarettes are flavored. But let me talk about what do we mean by flavors, because I think that's sometimes not clearly understood. Your unflavored water that many of you have does impart a taste. It does have some sort of flavor. But the definition that is commonly used is referred to as a characterizing flavor. And that can be conceptualized as comprising three aspects: the chemical makeup or the chemical compounds, the sensory experience, and here we're talking primarily taste, but also smell, and the imagery, colors, descriptors that convey the taste and are often part of the marketing and packaging. Frequently in policy action and the FDA, traditional tobacco flavors are distinguished from other flavors. And which of these characteristics matters? I think it depends on what we're talking about. So it is probably not news to this audience that flavored e-cigarettes are in the national spotlight with significant concern among policy makers, educators, parents, youth, and among others. And the reasons are severalfold, which I'll elaborate on in the next few slides. Just summarize here, we have ample evidence that flavors play an important role in their appeal and use of e-cigarettes, and particularly among youth. Flavor additives may also have direct consequences. And while per the final deeming rule, and I think this is important because often people think e-cigarettes are legally marketed. E-cigarettes are, as of now, there's no e-cigarette that can be legally marketed without pre-market tobacco authorization by the FDA. But the FDA is exercising its enforcement discretion to currently allow flavored e-cigarettes. And I'll come back to this briefly in my concluding remarks. So turning to e-cigarettes and flavors, e-cigarette manufacturers and retailers have been marketing their products with flavors that appeal to youth. And here are just a few examples. A considerable amount of evidence indicates that these appealing flavors are attracting youth to e-cigarettes, as you've already heard. And in particular, we see non-using youth indicate greater interest in trying e-cigarettes, particularly if they're menthol, candy, or fruit flavored. Nearly all youth e-cigarette users also use flavors other than traditional tobacco flavors, and the vast majority of these say that they use e-cigarettes because of flavors. And we see that the majority of youth users say that they wouldn't continue using e-cigarettes if they were not flavored. In research that Melissa Harrow and myself and others have published, we find that the most common flavors, the most popular, are fruit and candy flavored / dessert flavored flavors, and the least common is tobacco. In addition, there is evidence to suggest that flavors may also affect the perceptions that youth have of e-cigarettes, particularly their safety, how safe they are or how harmful they are. Now, policy would be actually quite relatively straightforward if flavors were only appealing to youth. You just ban certain flavors or all flavors. But we also find that flavored e-cigarettes appeal to adults. For instance, in research I've conducted, adult smokers who use e-cigarettes were equally as likely to initially use non-tobacco flavors as they were tobacco-flavored e-cigarettes, but they flavored non-tobacco flavors in recent years. And we find that former smokers who currently use e-cigarettes were more likely to choose non-tobacco flavored than tobacco-flavored e-cigarettes by about a 3-to-1 ratio. Like youth, fruit flavors are popular, but we do find some differences. For instance, older adults are less likely to use fruit flavors, even though it's most common, and more likely to use menthol. Also, like youth, we find that adults also are preferences for flavored e-cigarettes is linked to the perceptions of the harm or safety of them. And furthermore, as was covered earlier, we find that there's emerging direct evidence to suggest that flavors may affect smoking cessation, reduction in quitting among smokers who are using e-cigarettes to replace their smoking. So switching gears a little bit to e-cigarettes and health. As Dr. King already discussed, we see that e-cigarette flavors are sometimes labeled and marketed as grass. And as you've already learned, this is FDA designation that basically, when added to food, it is considered safe by experts and is exempted from the usual Food and Drug Cosmetic Act food additive tolerance requirements. And as you've already heard, and I like to reiterate, it does not necessarily apply to flavor additives when they're aerosolized and inhaled. With this mode of use, there may be adverse health effects. A number of volatile flavor components have been identified in e-cigarettes, for example. Several studies have looked at, and with my cold, I can't say cinnamon halide. In one such study, 20 of 39 e-liquids examined this compound at concentrations that were considered cytotoxic and genotoxic to human embryonic and lung cells. And I think that was the North Carolina study that someone had asked about earlier. Benzaldehyde, which is used to impart a berry tropical fruit taste, was found in about half of e-cigarette refill liquids tested in another study. And as you've already heard, diacetyl and other compounds have also been found in more than 90 e-cigarettes in another study. We also find that e-cigarette that flavor compounds may affect nicotine absorption and may affect the reinforcing effects of nicotine and nicotine dependence. But with all that said, however, there are some limitations in our knowledge of health effects of e-cigarette flavors, which are hindering, I think, our regulation around them, at least as far as our health effects are concerned. First is that many flavoring additives have not been evaluated for toxicity in e-cigarettes where they're inhaled. Second, most of the research has been conducted with animal models or human cells in vitro, and there are very few clinical studies with humans that have been conducted, and certainly not across a broad range of e-cigarette use patterns or devices. And third, as is more generally the case with e-cigarettes, we don't have the long-term data to look at the effects of inhaling compounds through e-cigarette use on long-term disease and mortality. So with this brief overview in mind, I would like to conclude with some comments on the policy landscape regarding e-cigarette flavors and the regulatory challenges. At the federal level, most of this has been happening with the FDA. So in March of this year, FDA issued an advance notice to propose rulemaking on flavors, focusing on youth and adults. Since May, the FDA has sent several warning letters to companies for selling e-liquids, resembling kid-friendly products, as I had showed you earlier. In July of 2018, the Stopping Appealing Flavors in e-cigarettes for kids bill is proposed, and if passed, would give manufacturers 1 year to prove that e-cigarette flavorings aren't harmful, don't tempt kids, and help smoke adults quit. And most recently, FDA moved to enforce the 2016 deeming rule with respect to flavored e-cigarettes without pre-market authorization if they are not sold in age-restricted in-person locations or through online stores with heightened age verification practices. Much of the work, though, as Dr. King had noted, is going on at the local level, and several localities have banned the sale of flavored tobacco, including e-cigarettes. Most notably, I think lately is San Francisco. So there are some regulatory challenges with respect to flavors. One is balancing the concerns for youth use with adults who are using e-cigarettes to quit smoking, as we've seen that flavors do seem to play a role there. The other is the complexity of flavors, and I can expand on this if people have questions later. And finally is the concern about unintended consequences. For instance, a ban on cigarette flavors could push nicotine-addicted youth to combusted tobacco, whether it be flavored little cigars and cigarillos or mentholated cigarettes. So we need a comprehensive policy that covers all tobacco, not just e-cigarettes when it comes to these things. And that's all I have for now. Thank you.
Thank you. The next speaker is Dr. Pat Purcell, who's the president of the Kentucky chapter of the American Academy of Pediatrics.
Good morning. So I am going to talk to you about e-cigarettes in adolescents. I like to call it vaping, puffing,